Today, I will be giving you a brief rundown of STDs and STIs, various bits of information about them, and how to prevent them. Let's get started. First, you may be thinking, I already know everything there is to know about STDs. I learned all that stuff back in middle school. Well, you probably actually don't know everything there is to know. You're probably just suffering from what I like to call know-it-all syndrome. This is when you think you know everything there is to know, but you actually don't. Here, let's try this quick exercise. Can you name 5 STDs/STIs? Take your time. Sure, it shouldn't be too difficult. Okay, now ask a friend to name 5 more, but they can't be one of your 5. Now, that's a bit more difficult. Believe it or not, there are more than 5 STDs. Actually, there are at least 25 STDs/STIs. Few of them are listed here, and a few of them we'll also touch on in this video. First, we'll start with chlamydia. Chlamydia is very common and is a bacterial infection. Symptoms are usually none, but in women can cause unusual discharge, abdominal pain, and pain while urinating. For men, it can cause urination pain, discharge, and swollen testicles or tenderness of the testicles. Luckily, there is treatment for chlamydia. It would just simply be a course of antibiotics. Next is gonorrhea. Very common as well, and is also a bacterial infection. The symptoms, usually as well, none, but for women can include painful sex, genital swelling, and yellowish discharge. For men, it may include urination pain, penile discharge, and frequent urination. Gonorrhea is also treatable by the same method of a course of antibiotics. Gonorrhea is also marked by pain of the genitals, hence the name gono for gonads and rhea for pain. Next, there's hepatitis B. Hepatitis B is also common, and I'm sure you've heard of it. There is no cure, as this is a viral infection. Symptoms include loss of appetite, fatigue, vomiting, and in later stages, jaundice. Hepatitis, HEPA, affects the liver. That's why jaundice is one of the symptoms, and if it gets too severe and left untreated, it can destroy the liver, resulting in yellowed skin and other complications. Next is the big one, HIV and AIDS. You've all probably heard of this one. It is very common and is a viral infection. There is no cure as of yet. Symptoms of HIV, the virus portion, are none. Most people will never know they have HIV unless they get tested. There are the usual cases of, glands may be swollen, but that's present with any infection. Symptoms for AIDS, which is the severest case of HIV, can result from anywhere from extreme fatigue, frequent sickness, unexplained weight loss, and unexplained bleeding. There are also many other symptoms of AIDS, and that's because it is an immunodeficiency, which can result in infection of anything. Next is human papillomavirus, also known as HPV. Very common. It's also viral, and the symptoms are none. And it has no cure. That's because it's a virus and it's hard to find cures for viruses. And luckily, it goes away by itself, usually after 4 to 6 weeks, without causing any complications. Though there are 2 kinds of HPV. There's low risk, which usually results in genital warts, which are painless and not much of a problem. And there's high risk, which can result in cell mutation, which, of course, can cause cancer. Then there's syphilis. Syphilis is very common. It's also a bacterial infection, and the symptoms often none, but can be a sore or open wet ulcer, body rashes and fatigue, and if left untreated, can cause damage to vital organs such as the nervous system, the heart, and the brain. Prevention. The number 1 source of prevention, abstinence. And then there's protection. Abstinence, as you already know, is refraining from sexual activities. It is almost 100% safe from any STD. But of course there are the few, such as scabies, which is not mentioned in this video, which you can contract just through close contact. Next, the protection would be the use of condoms, male or female. These prevent the transfer of vaginal and or penile fluids from coming in contact with each other's bodies. That way, no form of the disease can come in contact with the other person. Dental dams also do this for engaging in oral sex on a female. And there you have it.